Ragini is a volleyball player. During a volleyball game, she twisted her knee. She was able to get up and bear a weight with support. So, as a coach, trainer, and therapist, you advised her to stop playing since you wanted to prevent further complication. Is right, and asked her to apply ice with whatever basic knowledge that you have. She consulted for further treatment with the physio. What kind of electrical stimulation modalities can they use for further improving the outcome of sports rehabilitation, and how these modalities can aid in early return to play? If we are looking for answers to these questions, you are at the right place. Welcome to this NPTEL offered course on physical medicine and rehabilitation in sports. We are in week 7, wherein we are covering various therapeutic modalities. Today's lecture is on electrical stimulation and ultrasound in rehabilitation. You are with me, Wing Commander Chandrasekhar Guru. I'm a sports medicine physician, associate professor in the field with the Department of Sports Medicine, Armed Forces Medical College. The learning objectives for today's lecture are: we try to understand the need, aligning the sports injury rehabilitation phases and therapeutic effects of the electrical stimulation and ultrasound therapy. What is the rationale for use? Briefly, we will describe about the rationale of electrical stimulation as well as the ultrasound therapy in sports rehabilitation. And we also discuss a case wherein we can try to use this concept, how to use them in practical scenario. So, you're very much aware in this particular course, towards the fag end of the course, we are week 7. So, it is very clear now that there is a changing paradigm in the physical therapy of, especially in sports. This an increasing need in the practices of various rehabilitation therapies and modalities that are available. The need has shifted from a passive kind of care to more on an active, technology integrated protocols have come up. There's more of an evidence based practice where athlete is the center of that particular approach. So, with such kind of a changing paradigm, it is important to understand the therapeutic modalities in line with the tissue healing principles. So, we have already discussed about the various principles of tissue healing. Let's see it again and recapitulate the concept. So, after injury over a period of time, in the initial phase of 3 to 7 days, called the acute phase or the phase of inflammation, wherein you have the 5 cardinal signs of inflammation which are predominant in this phase are rubor, tumor, calor, dolor, and loss of function or functionalisa. So, the body responds by causing an inflammatory response immediately following an injury. Subsequently, with the ingress of various cells in the blood, these cells starts the kind of repair process, wherein you have a lot of laying down of the collagen, bringing in various chemicals that kind of aid in faster healing, and it kind of forms the basis of the granulation tissue. And this process is called as the phase of proliferation, wherein it lasts till about a week to 3 weeks time, depending on the size and extent and the location of the tissue. Now, post 3 weeks, the cells or the layer that has been laid over the tissue that has been injured to fill up the gap. Now, these layer and the cells undergo kind of remodeling based on the line of force that is passing through that particular tissue. So, the remodeling happens and then it becomes more mature and then gets stabilized, and it may not reach a level of pre-injury status, but then the body always tries to reach to closer to that particular level. So, depending on the type of tissue, it may extend even up to certain months or even years. So, how do we align our rehabilitation goal with this tissue healing process? So, in the initial phase of inflammation, we have the acute phase or phase 1, wherein we focus at controlling further damage or preventing further damage, protecting the tissue, and control the inflammation in terms of the cardinal signs, mainly the pain and the swelling. So, you try to address the impairment during this phase. Subsequent phase during the phase of proliferation is the subacute phase, where you kind of focus more in terms of with a reduction in the pain and the swelling, you focus more in terms of restoring the function, the normal range of motion, the strength, the coordination and the flexibility aspect. Once a basic level of strength and restoration of function of activities of daily living is achieved, then you focus on the phase 3, that is return to sport, where the individual is in a state where additional sport specific drills can be carried on, advanced strengthening exercises can be carried out. And towards the end, before the individual is returned to sport, it is important to also incorporate the phase 4, that is re-injury prevention phase, wherein you have a long-term re-injury program kind of part of the sports training, and the individual is kind of cleared for return to sports. So, with this concept or background in mind, let's consider what is the role of electrical stimulation modalities and ultrasound in this particular lecture. So, using electrical currents for healing, you can kind of stimulate the nerves and the muscle both. So, this helps in kind of relieving the pain, reduce the inflammation and promote healing. If you want to use the electrical stimulation for pain relief, it is the TENS or transcutaneous electrical nerve stimulation. And if we want to use electrical stimulation to kind of stimulate a muscle, then it becomes a neuromuscular electrical stimulation. So, it depends on the need. So, how does it work? It is basically controlled electrical current to activate either the sensory or the motor nerve. When we activate a sensory nerve, it helps in kind of giving a pain relief, and if we activate a motor nerve, it can help in kind of creating a muscle stimulation. So, it by using the stimulating these nerves, we can increase the circulation, activate the muscle fibers and reduce the pain perception. So, we can, it also can be used to kind of reduce the muscle spasm. Earlier it is used, it is better to kind of activate and kind of re-educate the muscle as well in the process of sports rehabilitation. What are the types of electrical stimulation that we have? We can say TENS, which is again transcutaneous electrical nerve stimulation, mainly for pain modulation using the pain gate theory. Neuromuscular electrical stimulation, mainly to strengthen the muscle, activate the muscle, generally used immediately post surgical to kind of activate the inhibited muscle. You can use interferential currents, again electrical current used in medium frequency to kind of produce a pain relief and muscle stimulation. So, depending on the frequency, you can use it for both. And electrical muscle stimulation can to re-educate the muscle, can be innervated or a de-innervated muscle using Russian currents or a galvanic current. So, tailoring the need as per the treatment is the key in choosing the electrical stimulation. According to the goal, appropriate and the phase of rehabilitation, we can choose the electrical stimulation modality. What are the application? In sports rehabilitation, it kind of may be used to kind of manage the pain both in acute as well as chronic injuries. Muscle strengthening can be carried out in case of weakness or because of disuse, as we discussed, maybe post surgery there is a disuse, so that can be used. Post surgical rehabilitation, as I mentioned, can be used for both pain modulation as well as for muscle re-education. Inflammation reduction and tissue healing is also an important aspect. By reducing the spasm, it reduces the, it also affects the circulation. So, there also you can use for reducing the inflammation and tissue healing. Benefits, yes, it is a non-invasive modality, so safe when it is properly used with certain precautions. It helps to reduce the pain, decreases the spasm, improve the kind of healing, and reduces the inflammation as well, improves the circulation, thereby it hastens up the process of healing, complements the exercise therapy. You can use it to improve the strength as well when it is clubbed with a proper strength training or a exercise therapeutic exercise program. So, mainly it is to give adequate pain relief and to have muscle strengthening effect locally. So, let us discuss a case. With the initial case which we started, the volleyball player, she landed and then ended up in a knee injury, and she was able to get back and bear weight, and immediately post injury she was given cryotherapy and she consulted the team physio. So, what are the various electrical stimulation modalities that one can use in sports rehabilitation of the question? So, probably a ligament sprain in this particular individual is too early to say. Maybe in the phase 1, it is cryotherapy, that's what we discussed, immediate ice application in the first phase, this PRICE protocol. Then you give an interferential therapy around the knee that can be used to kind of reduce the pain as well as to reduce the swelling. So, it is in both different frequencies you can use that electrostimulation modality for pain reduction as well as for swelling reduction, and you can club it with an exercise therapy. So, in subsequently moving ahead to phase 2 of the same individual, you can use again continue with IFT for swelling as well as for pain. You can use a neuromuscular electrical stimulation modality to kind of activate the vastus medialis obliquus. So, this is the muscle around the knee. Whenever there is an inflammation or pain, this is the muscle which goes in for inhibition, and if not properly addressed may go in for disuse atrophy and wasting. So, it is important to address this particular muscle. So, if we can use an electrical stimulation method to kind of activate this muscle at an earlier stage itself. So, that helps in kind of voluntarily also individual trying to activate it when the this thing is used. So, this helps in kind of re-educating the individual also to activate the particular muscle. Thereafter, it can be also clubbed with various isometric concentric exercises, and also kind of reduction in pain also helps in increasing the range of motion as well. You can also use a pain relief modality in the terms of TENS around the knee. TENS is nothing but transcutaneous electrical nerve stimulation, mainly for the pain relief. So, that is how we can use an electrical stimulation modality. Let us move on to the ultrasound therapy. Ultrasound therapy is one of the commonly used modality for multiple therapeutic effects. It uses the sound waves for producing healing in the tissue. High frequency sound waves used to promote tissue healing. It can be used both for superficial as well as deep tissue depending on the frequency of the wave. The commonly used frequency are 3 megahertz and 1 megahertz. So, it is 3 megahertz used for superficial kind of therapeutic effect. If you want a deeper therapeutic effect, then you go for a 1 megahertz frequency. So, the two types of ultrasound are based on the mechanism is the thermal ultrasound and non-thermal ultrasound. Based on the frequency that we use, it can be used to have different therapeutic effect. So, the thermal effect, where it is basically by eating the tissue using the sound waves at the deeper level. So, here you use a 1 megahertz frequency for deeper tissues, and it kind of promotes the circulation and helps in relaxing the muscle. So, it is almost equivalent to a diathermy with better advantages, which we will be discussing. The other ultrasound mode is the non-thermal mode, wherein you use ultrasound at the superficial tissues at a frequency of 3 megahertz, basically to have non-thermal effects to promote cellular repair and reducing the inflammations used in the initial phases, phase 1 itself. You also have two different modes in ultrasound. One is the continuous mode similar to diathermy, and the pulse mode. So, pulse mode is that pulsed kind of transmission of the waves. So, you have a gap in between. So, that helps in kind of making a pulsed kind of passage of the wave, and that has different effect on the tissue. So, based on the therapeutic requirement goal, the mode can be set. What is the mechanism of action? Here in the picture you see applicator which has a kind of crystal. When this crystal is activated using electric current, it kind of undergoes piezoelectric effect and produces mechanical sound waves. So, these sound waves are transmitted to the tissue, and the connection with the tissue is through the ultrasound gel through which the sound waves passes. So, mechanism is that thermal effect, as we discussed, it is in the deeper tissues. It produces the sound waves penetrate the tissues deeper and then produce mechanical movement of the tissues. The cell again mechanically penetrate and then mechanically move against each other and produces the thermal effect. It increases the blood flow, increases the cellular metabolism, and decreases the spasm. When we see about the non-thermal effect, it is in the superficial level. The frequency is 3 megahertz, wherein a process of acoustic streaming and micro massage. So the applicator also, it's kind of given a circulatory motion around the area where it is being applied. So the acoustic streaming and micro massage kind of propose to have increased cellular repair effect. It increases the movement of the fluid and kind of decreases the inflammation and decreases the pain. So with these kind of effect, it enhances the healing in the acute stage itself. So if you want a ultrasound to be used for faster healing, enhancing the healing aspect in the initial phase, you go in for a non-thermal effect. In the later phase of sports rehabilitation, where you want more of a reduction in the spasm and hastening of the healing by increasing the circulation, then you go for a thermal ultrasound with a 1 megahertz frequency. So in sports rehabilitation, it can be used in acute soft tissues like a sprain or a strain can be used. It can be used in joint injuries as well, like cartilage repair, or in ligament sprains. Can be used in chronic inflammation in thermal mode, wherein you can use it for tendinopathies. You can use for scars also to kind of mobilize the scars. You can also use it in chronic non-healing ulcers as well. In bone injuries also, ultrasound has a good found to have good application, especially in stress injuries, where at low intensity pulsed ultrasound called as LIPUS can be used to promote faster healing in the stressed bone, and it can also be used in fractures as well. So the benefits are, it can be used in both acute as well as chronic, using the non-thermal as the thermal effect. It can be used for superficial tissue as well as for the deep tissue, and it accelerates healing by promoting collagen production and reduces the pain, spasm and stiffness. So it can be also used for providing deep eating in the tissues as well without causing any tissue damage. So this is such a modality which can be combined with other therapeutic for multimodal approach. So in this era of changing shifting of gears in the physical therapy approach, for an accelerated return to sport, combining therapeutic modalities using sound scientific rationale aids in kind of a better outcome. So combining, it can be combined, electrical stimulation can be combined with an ultrasound therapy, with manual therapy, exercise. It kind of targets different phases and what is the goal that you achieve, therapeutic goal you achieve by using a particular modality. So it is again customized for the phase, customized for the therapeutic goal, customized for the individual. How the individual is responding to a particular modality also matters. So that's an important take-home message from this particular lecture, is that you need to have scientific rationale in choosing the therapeutic modality. Just because it is there, it cannot be used everywhere. It has to have a scientific rationale. The precaution and contraindications case of electrical stimulation is that preferred not to use in pregnant uterus, pacemakers and open wounds with cancerous regions, preferably not to be used. So it can stimulate and further kind of spread this particular infection or the cancer cells. Ensure correct placement of the electrodes, because electric current is involved. It is important to follow to these precautions. Monitor for skin irritation and burns based on the various electrodes that are being used. It is important to monitor that. Use ultrasound therapy. Again, contraindications are pregnancy, cancer, deep vein thrombosis, should not be dislodged, infections again. It's important to choose the right mode as well as the right frequency when before applying, so that it doesn't cause tissue damage or burn in the local region. And monitoring is also important while using the ultrasound machine. The best practice recommendation would be in electric stimulation, use a proper electrode for the specific region. And skin preparation is important, because electrode sometimes may be kind of adhesive based, so you can have the hair over the skin also sometimes may have to be properly prepared, so that it doesn't cause problem while removing the electrode. Start with low intensity and gradually improve based on the improvement or subjective response from the patient or the athlete. tailor the frequency and the pulse and the duration based on the response. With respect to the ultrasound, selection of right frequency and the duration is important depending on the location of the treatment region. Move the ultrasound head slowly so that you have a circular movement, and then causes the micro massage as well for even distribution. There should not be any gap between the applicator head and this thing, so it is important to have adequate gel contact. In fact, you can use even diclofenac gel added to that can also be used for additional pain relieving modality called as phonopheresis. So the future trend that we see in electric stimulation and ultrasound modality is that the equipment have become more portable and become more hands-free, user-friendly for sports setting usage. Say in this particular picture, you see an hands-free ultrasound that is being applied onto an athlete. So that's how you can also save where multiple athletes are available in a particular physiotherapy unit where you have limited resources in terms of the therapist. Then these are the ways by which the innovation and technology is helping in proper rehabilitation and helping the resource allocation as well. You can also club it with biofeedback to have proper muscle re-education and learning when you use muscle stimulation, electrical stimulation modality. It can be more interactive and augmenting with virtual as well as augmented realities to the biofeedback. Increased focus is on individualized and patient specific treatment plans. So again, I am repeating, having a sound scientific rationale and also an evidence based practice is important in kind of utilizing this in a multimodal targeted approach. So to summarize, electrical stimulation and ultrasound therapy offer effective non-invasive treatment for musculoskeletal condition. Both the modalities improve the tissue healing, reduce pain, enhance the muscle function. Integrating them into the sports rehabilitation as per the phase and as per the rehabilitation goal kind of improve the patient outcomes as well, and complementary to the exercise therapy obviously, and it also kind of enhances the adherence because it modulates the pain and the inflammation, so that helps in kind of adhering to the exercise therapy as well. So for those of you who are interested in further in-depth understanding of the topic, I urge you to go through these books. They are very good resources on these topics. Thank you for joining for today's lecture, ladies and gentlemen. Jai Hind.